People suffer in homelessness.
Congestive heart failure, severe diabetes, schizophrenia, whatever the diagnosis is, the instability of homelessness exacerbates the very diseases that we're trying to treat. And it does so in very expensive and harmful ways.
I didn't feel I had a purpose. I also had 4 suicide attempts. The last one, they had to bring me back. Woke up and the doctor was talking to me and I asked him, why did you bring me back? So I had to do this all over again. I wasn't even grateful for him saving my life.
People suffer in their dignity and self-respect.
My mental illness was just untreated. I was ashamed of it. I ended up walking around with layers of clothes, matted hair, pushing a grocery buggy with a lot of junk in it, smelling the worst that you could possibly smell. And I wanted to smell like that just to keep people away.
When you live in homelessness, especially when you have an untreated mental illness and an addiction, you are just trying to survive.
I think we see the daily realities of homelessness and the impact it has on the patients. We see the direct bad outcomes and the poor outcomes with that, and that's hard.
Housing doesn't have to be a tent in the woods or living in your car. Housing insecurities can be, I remember not being able to, I wasn't looking at treatment. I was going and I was checking my bare minimum boxes, but only because I absolutely had to. Anything else was completely and totally, whether it was trying to deliver phone books or trying to get a job at the fast food place or whatever it was, I had all my energy and time wasn't on treatment and getting better, it was on survival.
Housing is healthcare. People die with a much more shortened life expectancy than the general population, not only because of their disability, but because of their social circumstances and environmental circumstances of where they live, and do they have access to food and to hygiene. It's the human nature of housing as healthcare, that the more somebody feels valued, the more somebody feels like they deserve a better life than where they've been. That's when all of the possibilities and opportunities open up for them.
This agency saved my life. So, you know, it's hope for anybody that wants to change. If you come here, we'll take that hope and ride it with you. If you don't have the hope, we'll carry the hope for you.
Primarily the folks that come to us have some sort of mental health or substance use disorder, and we support them whether it's through homelessness. Pretty much wherever they're at, we meet them where they're at in their recovery journey.
It's not to have people live independently, but interdependently, because when you think about your own life, none of us really live independently. We all kind of depend on someone, right? Whether it's your immediate family or your friends or your neighbors, you've got somebody in your life that you call when you need someone, and that's what we want for everyone. We want everybody to have that opportunity.
Since I know before you said you were in the hospital like 3-4 times.
Yeah.
So since you moved into your apartment.
I haven't been once. 4 going on 5 years.
We truly meet people where they're at, and they're able to be authentically them, and we have a well-established wraparound supports for folks, from employment, housing, tenancy support, peer respite, warm line. I mean, we really can support the whole person.
What we do is we give them the hope. We give them the opportunity to grow, letting them find their purpose, helping them with their pride, their dignity, being told all their life that you ain't gonna mean nothing, you ain't gonna amount to anything, and giving them hope, finding something that they find important about them.
It's not supposed to be, but I'm on 24-hour call, 24/7 for anybody on my caseload, even when I'm on vacation.
And why do you do that?
Because I know what it's like not to have somebody there. When things fall apart and you reach out, it's very important that you have somebody that you can reach and talk to and be there for you.
When we think about the conditions that led to somebody living in homelessness, whether it be their car, whether it be the woods, whether it be a family shelter, a domestic violence shelter, every facet of what led somebody to that point in their life is around the trauma that they have experienced. We not only need to treat the trauma, but we need to treat the environment and the conditions in which people can recover and heal. I think what we have shown over the past decade of really working inside the housing and homelessness space is, yes, you're gonna run into some brick walls, but all that means is, okay, let's figure out another way. And I think that's the lesson in this for all of us, is that sometimes you have to figure out another way.